Hello, everybody. My name is Dr. Steve Johnson, and I want to welcome you to this short orientation to seeking safety. It is a present-centered therapy with high research support that is effective in the treatment for many clients who have both PTSD and substance use disorders. So it's a quite helpful model that can cover both kinds of conditions. So let's get busy with with this orientation. And the first topic is PTSD. Why does diagnosis matter? And I'm going to look at treatment guides around this. Okay. First thing is that treatment timing is tremendously important. And so PTSD, we don't want to rush the treatment of PTSD, and we don't want to delay it, and we need to know that the client is ready. If there's a high level of dissociation, then that can be problematical. So what I like about this model is that it will guide the treatment timing, and that is very important. And why we need accurate diagnosis of PTSD. Also, an accurate diagnosis will prevent mature trauma work. If they're not ready, this will be important to know what that diagnosis is. The other thing that is tremendously important is the risk of PTSD and its impact on substance use disorder is huge. They're often co-occurring disorders. And so if an individual with substance use disorder has a high incidence of PTSD or has PTSD, that can be even a higher risk. The other thing is when we think about PTSD, we need to realize that it is a disorder of threat. It's grounded in the perception of threat and the experience of that threat, and the impact is on emotional dysregulation. And we'll look at what those symptoms are in just a minute, at least the categories of symptoms, what we might call PTSD core clusters. One of those is trauma exposure. The individual must have been exposed to the trauma or viewed the trauma or has heard consistent stories about the trauma, or maybe in a profession where they're like first responders and they're exposed to that kind of trauma frequently, or even watch movies of trauma. For example, if someone guides drones and sees consistently individuals killed due to the drones, that could be problematical. Okay, that would count as the trauma exposure. The other category of symptoms are what we call intrusion symptoms. Due to we have the memory of the trauma right here, right now. That intrusion can be a flashback. It could be really bad dreams, nightmares, all kinds of intrusions that are quite difficult to deal with. The other category is avoidance. Now, there are different kinds of avoidances, and we can think about internal avoidance or even external avoidance. An individual may be wanting to avoid situations that remind them of the trauma or the incident or location of that trauma. Or it could also be an internal avoidance, wanting to avoid even thinking about it, etc., okay? Because it causes such emotional distress. The other category is mood and belief shifts. There are major changes in mood regulation, and beliefs. We see perhaps radically different beliefs about the self. The self may be seen as now damaged or irreparably damaged. The world They may have a belief that the world is utterly unsafe, whereas before that wasn't the case. So we see this marked shift. Someone who may have been happy before the event may have depression, anxiety, etc. And the last category of symptoms is what we call hyperarousal. This would be experiencing high anxiety or physiological arousal and feeling jittery, etc., which can be very problematical and can lead to the substance use that we often see with PTSD. Often in substance use disorder, when they're co-occurring, the trauma often comes first. And then the individual with the trauma disorder then gravitates toward the substances to help regulate their emotions and then ends up addicted to whatever that substance was. Trauma, if untreated, is problematical too, because that could increase relapse in an individual who is going through the treatment of substance use disorder. And so treating trauma and treating addiction simultaneously tends to have better result. Now, the old model for treating PTSD or any other condition and substance use disorder was to treat the substance use disorder first and then treat the condition. But we've found that actually, if we treat them simultaneously, it's much better. If you think about it, let's say a person had anxiety and of the and trauma and co-occurring trauma, and we treated the substance use disorder and but didn't treat the anxiety that is associated with trauma simultaneously, then the cause of the anxiety in the first place would still be there, and we would increase the potential of relapse. On the other hand, if we treat trauma too early, that can lead to the destabilization of the individual. So it's really important that we look at trauma in relationship to substance use disorder in terms of treatment. Okay, why seeking safety? Why are you seeking safety for individuals? Well, one, it is probably the single best model, arguably, for the treatment of both trauma and substance use disorder, right? It's built in to treat both kinds of conditions, which is a wonderful thing to have. The other thing about it is very early recovery friendly. It is a nice starting point for individuals who present highly aroused and highly symptomatic. Also, it is really helpful in high risk populations, such as individuals with substance use and PTSD. The important thing is that it focuses on safety. I will talk about what we mean by safety in a minute, but it focuses on safety and establishing safety before processing. And so when seeking safety talks about safety, they mean safety in terms of relationships, safety in terms of emotions, safety in terms of cognitions or thinking, safety in terms of setting, etc. So it is really, really important that and of great value that seeking safety focuses first on establishing safety before moving into other issues. Okay. What are the principles of seeking safety? Well, we've already stated one. Safety is the priority. That is number one. But also, it is present focused. If we look at the treatments for PTSD, they fall into two major categories. There are those that are present centered, present focused, and there are those that are exposure based. Exposure-based treatments tend to imaginatively go back to the event and have an individual experience that event, focus on the event, and the emotions may arise, etc., and behaviors. Present-centered therapies for the treatment of PTSD focus on what to do in the here and now. They do not. In fact, in Seeking Safety, it is highly discouraged for a client to even talk about the past trauma, because then it could trigger other individuals too. And so they would focus on skills that they can use in the present for mood regulation, etc. The other thing that is important there is that many studies have shown that if an individual goes through exposure therapies, those can be emotionally painful. So the dropout rate can be a bit higher for exposure-based therapies rather than present-centered therapies. Okay, not that exposure therapy is bad. It can be wonderful for some people, but it can be a bit more emotionally painful, and the dropout rate can be, some a greater incidence of that. It's also an integrated treatment. It's integration of the treatment of PTSD and substance use disorder, and has a wide array of intervention types within it that I'll get to in a few minutes. One factor that I really like is that it's strength-based. We don't focus on dysfunctionality. We look at the strengths of the client and then we build on those strengths, which is a tremendously important thing. And then one area that I really like about Seeking Safety is that it focuses on skills over the story. Some treatments of PTSD have the individual tell the trauma-saturated story over and over and over again. That will not be the approach of Seeking Safety. They will be building skills to help when those stories come up and the individual becomes symptomatic. So I like that it does give some skills. Let's look at what it is and what it's not. What it is about skills and stabilization of the individual so that they're not so hypervigilant and aroused. It's values-based and it gives choice. People can opt out at any time. If there's a particular module, there are 25 modules within Seeking Safety, which I'll mention. Not what they all are, but I'll at least cover the structure of them. Anytime that the client is not ready, they don't have to opt in and participate within that. That is up to the individual. The other thing is that it is not exposure at all. And there's no focus on the trauma narrative or even trying to change the trauma narrative. And it's not past focus. It's focused on the here and now, rather than doing an archaeological dig of the traumatic event and going over it and over it and over it. Now, other models for the treatment of PTSD do that, and they have some success. This is a different kind of model. Okay. Now, let's look at the standard module structure. There are 25 modules or topics within Seeking Safety, and you can do these modules in any order. However, there are certain kinds of models that you probably want to do earlier than later. For example, one of the models is about grounding exercises. So what do you do when you are physiologically aroused so that you can get back down to a normal level or more helpful level of arousal? So often that will be first, or the orientation, of course, you would want to do that first. But the rest of them, you can change the order based on the issues that of the clients within the Seeking Safety group. By the way, seeking safety can be done in the form of individual therapy or within group, but it's an excellent group model. So what happens? Well, first, there is a brief check-in where they will check the emotional status of the individual, any risk behaviors. They may do a grounding exercise, and all of that. They have the right to pass. So the intro doesn't last a long time, but it's tremendously important. I always like to begin with a grounding exercise because you never know the level of physiological arousal of the individuals coming in. And so that kind of helps level the playing field in terms of hyperarousal potentiality. The second part is there's a quote for each module, and they frame that quote, and there's a brief reflection on the quote. They don't go into a deep analysis. They're not analyzing it, but just a reflection on how it's relevant to the lives of the group members or the individual who is going through the seeking safety. The third is the topic intro. What is the topic? I gave one. There's grounding. There's another on red flags and green flags about things that we need to stop. And then others, this is an invitation to move forward. So they have there's a topic, and they will explain what that topic is about. That's relatively brief. But more importantly even is, why does this topic matter? This is what I like. It is always the topics, they really focus, the supervisors or the people who are running it really try to help the clients link it to their lives. And then not only that, but show or talk about directly the link to the topic to PTSD and substance use disorder. So this is the so what issue. Why bother doing this topic? And this part answers the so what test. The fourth part is really to focus on key skills within that module. Typically, there will be between 2 to 4 concepts that will be covered. Not huge concepts. They're graspable and straightforward, but they're not overloaded. 2 to 4 concepts. You are to use simple language. It's great for all levels of education, etc. The important thing here is also the individual always has choice and agency. They're not, so that they don't feel trapped and unsafe. The ability to make choices are open and permitted to exercise within the group. In fact, it really makes the situation as safe as possible so people can feel that they have choice and have that kind of agency. 5, is practice. This is an exercise or reflection. And again, that kind of thing, you can be opted out. And also, no trauma details will be discussed in that. Of course, people can talk about the details, not at all about the details of the trauma, but the consequences of the trauma will be talked about. Those would be emotions, behaviors, relationships, and all of those kinds of things. So the trauma event itself, no, there will be no discussion. There will be no discussion of those trauma details, but the consequences of the trauma, of course, will be explored around the skills building that is necessary to address them. It's the other thing is, it is always contextualized for using the skills in real life. It's not abstract. And so there will be the talk about situations in which you can use those skills, and one situation, that not multiple situations, one safe action that a person could take, and realistic goals, kind of SMART goals, right? So that they're concrete and attainable, not really abstract, but that an individual can take steps to help reach those goals realistically. And then there is a closing. In the closing, which doesn't take a lot of time either, there's a key takeaway. Like the discussion of what will you take away from this Seeking Safety meeting today, and each client has the opportunity to talk. And it is not atypical for a group to end with grounding, because as much as Seeking Safety is not exposure, and so they're not going to be talking about the traumatic event itself, you never know what may trigger an individual, so you'll want them to leave feeling like an adult with agency, and so ending on a grounding exercise can be tremendously important. And then finally, there's a preview of the next topic. Now, I do want to cover some practical tips. One, it's highly, highly recommended that you have 2 individuals facilitating the Seeking Safety group. Ideal if they're licensed individuals. But why is it important to have 2? Well, if someone in the group, in the middle of the group, becomes triggered and symptomatic and is highly physiologically aroused, one of the facilitators can take that individual either to another part of the room, out in the hallway, whatever. That would be collaborated with the individual and the facilitator, and they would walk through grounding exercises. And if the individual feels less physiologically aroused, they can return to the group, and it is seen as a strength that an individual did do the grounding exercises and returns to the group if they're able. So that is a practical tip, and one that I think is really, really important if your setting could permit that, if there's enough staff to do that kind of thing. Another one is emphasis is on structure and predictability, because structure and predictability contributes to the safety of the individuals. There's no trauma processing that is going on. There is skills building for how to handle it when they experience arousal or, really, really great discomfort. And so they can better deal with that. So there's better mood regulation. Excuse me. We watch activation when that occurs, if there's dissociation, etc. Then again, one of the facilitators can help the individual move to another part of the room or another room or out in the hallway or something, just so where they're safe, and try to get that activation down. Also, we want the therapist to have like a calm stance when they're with the individuals, and so that would add to the safety of the setting itself. Safety is highlighted more than insight. We want the environment to be really, really safe for them. And early on, they may not have great insight, but we will establish safety so that can give them a setting in which they can explore and gain insight into the skills that they can use. And as I said, there's a huge advantage for co-therapists. So I hope in whatever setting you're in, that is a major possibility. So I hope you get a feel for it. What I like is that there's a wonderful manual that was written by Lisa Najavitz, the originator of the Seeking Safety method and model. And so you can get that on Amazon or through online, through going to the website of Seeking Safety. And so it's affordable, and it's an excellent resource where everything is there. It's manualized and makes it so much easier for individuals who want to start running those groups. So I hope this is helpful. If you have any questions whatsoever, feel free to email me, and I will do what I can to help you. Have a wonderful day. Bye-bye.